Hello and welcome to yet another episode of Hair Talks by Terra Medical. My name is Dr. Joshua Chong and today we'll be talking about precision medicine in hair restoration. Now, while doing Hair Talks by Terra Medical, which has been quite a long-running series of videos talking and discussing about the pros and cons of various hair restoration techniques, we've come to make this channel quite an inclusive and tailored approach to a multitude of different kind of populations. And it's the same when it comes to discussing your hair restoration. So today's topic, precision medicine, actually focus on the unique individual. And everyone has different requirements or expectations when coming in to discuss about how they can improve the appearance of their hair. Sometimes that would be including the requirement of lowering down their hairline or improving the shape of their hairline. Or sometimes they just want to protect the existing hairs that they have left or increase the density of their hair to make it look fuller. And everybody comes in with a different understanding of hair loss, its origins, whether their family has a contributing factor in terms of genetics, and what they're able to accept in terms of medications or the medication side effects. And all these are taken into consideration when we are meticulously planning the treatment experience for our patients. Not only do we use bedside analytical tools like trichoscopy and using a pull test and examining the scalp very close up, we also use precision-guided tools such as the AI-assisted TrichoLab device that we have. And in certain jurisdictions, they have validated the use of using genetic analysis to assess whether someone is going to be benefiting from various pathways of treatment, such as blocking the androgen receptor or using a regenerative pathway to benefit the thinning hairs from androgenetic alopecia. Now, why is precision medicine so important in hair restoration? It's because there is no one-size-fits-all treatment plan for individual patients. The density of the hair across the head will vary from patient to patient, and in order to achieve a very natural result that is congruent with the rest of their facial features, an individualized technique would be the most preferential technique when we're dealing with different patient groups. Let's take, for example, a 30-year-old man who has had a receding hairline versus a 60-year-old man who's had overall thinning of the top of his head. The approaches to using medication, side effect profile, considering things like family planning and sperm count and the possible side effects that they might face when taking medication, in addition to planning how many grafts we're going to extract from the available donor and the density of where we plant those grafts, position of the hairline, will give us an overall long-term satisfaction when we do it in discussion with our patients. So it's not just the art of discussing and planning the hairline and density and making certain adjustments, correcting during in-surgery. It is also the science of evaluating how many percentage of men are going to, let's say, respond to the use of finasteride and minoxidil. It is in combining the art and the science of using precision medicine techniques that the patient will probably receive the best treatment outcomes. And it does not stop at the treatment planning stage. There is also the monitoring stage that we will have to follow up our patients at regular intervals. Most likely that will be every 4 to 6 months. What happens at those junctures is that we photograph our patients' hair and make comparative images so that we can see how well they're improving. And if a patient does not respond adequately to, let's say, treatment plan A, how do we augment the results with adding on B or C or switching altogether if they're experiencing side effects from the treatment, for example. So the precision medicine approach is a holistic approach that considers a multimodal treatment plan that may include medications, surgery, regenerative techniques, supplements, or even just masterful watching and waiting to allow for your best treatment outcome. And if you have any questions, please leave them in the comment section below. Don't forget to click like and subscribe for more content on hair restoration.